Welcome back to another whiteboard chat. Don't know why I did that with my thumbs, but I'm so excited. Today we're going to talk about autoimmune diseases. So there are a lot of autoimmune diseases, some 80 plus, depends on kind of what you consider an autoimmune disease by definition, but there are a lot of them. A lot of them, like autoimmune disease in general, is pretty common. There are some that are more common than others. There are different levels of severity in terms of what they do. All right, so let's talk a little bit about what an autoimmune disease is, and I want to talk about some potential factors that can contribute to them, and then also just a couple things that, you know, to look for and things that you can do. Now keep in mind, this is not a talk about any particular autoimmune disease. If you guys want to talk about any particular common ones that might be more prevalent in the physique community, you know, talk about thyroid disorders or something like T1D or things like that, I can do that. I'm not going to talk about others, you know, that are really like way out of my scope, because that's not what I do. You know, that's something to discuss with your doctor. But anywho, you can comment on my social media or YouTube and let me know if you want to talk about any others. But so an autoimmune disease is, as the name implies, a disease that causes the immune system to attack healthy cells. So essentially, you're having an overstimulation of the immune system. There's a faulty immune response, and it's attacking certain cells and tissues, organs, things like that. Some common ones that people are definitely going to be familiar with, or probably familiar with, would be like type 1 diabetes, right? Where it attacks the pancreas, pancreatic cells. Things like Hashimoto's, thyroid, Graves', right? Potentially things like, if you've listened to my adrenal insufficiency, Addison's disease, right? So there's a lot of them. There are more severe ones that are common. Some of the more severe ones, like something like lupus, can be pretty severe, and statistically it's common. I don't know, there's, you know, a couple 100,000 people, or I don't know, something like that. I can remember off the top of my head, but statistically it's common, but it can be pretty severe. Other ones maybe not so severe. Some of them just may manifest as like certain skin conditions and things like that, rashes and things. Not that they're not annoying and difficult to live with, but they're not necessarily potentially fatal, right? So what are some of the factors? Well, there's a lot of medical literature is going to say there's no known cause of autoimmune diseases. If we're looking at all autoimmune diseases, just kind of lumping that in. Now, if you start breaking it down into more particular autoimmune diseases, there are definitely strong correlations with certain things that can potentially cause not only the disease itself to begin, but also flare-ups, right? Depending on what it is. Some things are kind of constantly there, some things will have flare-ups. Now, the first one I'd like to point out would just be genetics, because there are certain things, like especially like type 1 diabetes, for example. Usually these types of things manifest at a young age. They typically happen, a lot of time they'll happen like in juveniles, you know, it's not typically, if you've heard of like type 1.5, that they consider it like a late onset autoimmune diabetes type situation. That can happen a little bit later. But T1D, typically in younger people, it's going to start to occur. Once pancreatic function is damaged to the point of no return, essentially they don't produce insulin or very little insulin, and then they end up with insulin dependent diabetes. They have to have it, right? Okay, so genetics. That's a big one. Really not preventable, right? I'm not really an expert on this, but I would imagine there are probably certain things people can look for in infants, or maybe some pre-birth testing for certain types of diseases. I know they do that for certain things that might show some genetic variation. So, anywho, all right. Virus, bacteria, and infection. Well, those kind of all go hand in hand, but there are cases where people will have bouts of severe infection or bouts of severe virus or bacterial issues, and they will, from that, supposedly develop an autoimmune issue. Doctors suspect, or some of the literature I read suspects, this is probably the case. I've seen, I believe, some research out of Harvard showed that. They thought that was potentially one of the reasons. So obviously there's a large immune response from these types of instances, and then it kind of carried on, and certain cells were mirrored these viruses or bacteria or what have you, and then there was a continued response, and then that continued immune response was causing damage. So that could potentially be an issue. Now, gender. This is one that I don't see talked about a lot, but actually statistically, females have a much larger occurrence of autoimmune issues than males. Some of the research and literature that I've seen suspects it could have something to do with hormonal environment. Now, if you've watched any of my other videos or listened to me talk on any of the other videos, we know that females, especially in their hormonal environment, is a little bit more susceptible to interruption, right, from stressors. So as a whole, I feel like they have certain resilient characteristics, but certain characteristics that are a little more fragile. So statistically, females, a lot more susceptible. I think it's something like 80% of autoimmune diseases were women, which is crazy. And the more I think about it, most of the clients and like the individual single consults and stuff that I do, people that have autoimmune diseases, are mostly females. So definitely makes sense. Also, now let's say you have an autoimmune issue, all right? What are some of the things that may make it worse, or what are some of the things that may contribute to it, continuing to progress? Some of the things may be inflammation, right? So most, if not all, autoimmune diseases have an inflammatory component, because we know that the immune system and inflammatory response kind of go hand in hand, right? All right, so if you remember talking about on the overtraining one, how I talked about immune cascade and inflammation cascade, well, it's not really anything a whole lot different here. We're talking about some different factors, but essentially same kind of idea. So inflammation, people that I typically run into that have autoimmune diseases will often have, or autoimmune diseases that are especially uncontrolled, will often have a lot of systemic inflammation. And that's why a lot of these diseases will start to cause other discomforts, joint pain commonly. So there are actually autoimmune diseases that almost exclusively manifest themselves as joint pain, but there are, that joint pain can be a secondary type of side effect. Just pain and discomfort, lack of, recovery from activity, and so on and so forth. So inflammation is one of the things we're going to look for sure. Inflammation is kind of a clickbaity, hot button topic word, obviously. Go back and watch my inflammation video. You want to learn a little bit more about inflammation. So the gut. these two go hand in hand big time. So I see this a lot, honestly. So we've come to know that GI issues are a big problem, right? And a lot of people, and then Gen Pop and bodybuilders, whatever. There's just a lot of them. There's a lot more awareness about it. There's a lot more awareness on potentially ways to fix it and so on and so forth. Now, the gut is a center for systemic inflammation to start to manifest. It's localized initially, but when we start damaging gut lining, we have issues with permeability. We have things leaking out that shouldn't be leaking out. I'll give you a perfect example. People that have autoimmune issues that that cause rashes and skin irritation, once they have GI flare-ups, their skin flares up. I see it all the time. Not all the time like in everyone, but all the time in this people, that population that I work with. And yeah, it will show itself as like eczema type, psoriasis type flare-ups or things like that, right? So yes, don't forget the gut, because systemic inflammation and irritation in the gut will, or localized, will eventually become systemic, and you can run into problems. So, and that's not just with autoimmune diseases, obviously, but people with autoimmune diseases are going to notice some serious issues with this. Pinpoint stressors. So autoimmune diseases, depending on the type, depending on what you have, can have flare-ups, right? So pinpointing stressors or things that cause flare-ups is always good. Making a mental note, writing it down, whatever it might be, just keeping it in mind. Stress, it's just stress. I'm saying stressors because you're pinpointing stress. So essentially all you're doing is just being aware of stress. And irritants or things that you might ingest or activities that you might do that might be too much, that might cause a flare-up, or too much just overall stress in your life, or whatever it might be. So pinpoint stress. I put self-induced. Now, I said some things are genetic, but also it's also important to understand that some of these things are, I say self-induced because it's not that you're maybe doing one thing that's directly causing it, but there are like a cascade of events that will slowly trickle down and you end up with an autoimmune issue. So commonly I see like Hashimoto's, for example. I see this happen in women, especially, that have issues with stress and end up having issues with progesterone or pregnenolone steal, and then end up with estrogen dominance, and then end up with thyroid disorder, and eventually perhaps end up with disordered thyroid, and perhaps end up with Hashimoto's. Yeah, I do see this type of thing. It's not all the time, but it definitely happens. It's a result of these issues getting worse over time, continuously, right? And not being corrected. So yes, some downstream effect from things that you're doing directly, for sure. It's not always genetic. So with that being said, some of these things can also be corrected, for the most part, with correcting those issues, right? So, retracing your steps and really figuring out what, where it started, and correcting the problem. So that's not to say that you can heal all autoimmune issues. That's not the truth. And there are medications that are absolutely required for certain issues. Others are a little more manageable and potentially healable if you know where they came from, if you know, how body systems are interconnected, and how to correct those body systems and heal them, right? So that's kind of the gist of autoimmune issues in terms of what they are, how they might manifest, some different types, Potential factors. There are a ton of factors, but I'm just giving you an overlook since there are some 80 plus autoimmune issues. But like I said, if there are certain ones that you might want to hear a little bit more about that relate closely to physique enhancement, that's fine. I'll talk about those. Other ones are, like I said, are not really in my scope, and I would rather not talk about them. So feel free to comment on my Facebook or Instagram when I post the videos, or on my YouTube channel, and I will do my best to talk about them. And I hope this video is helpful. Talk to you next time.